So, Doctor, you were sharing about the challenges with reassuring parents and children when they come to a clinic, or especially when it's in a hospital like where you practice. Could you share a particular experience that you had where it was a challenge, and what did you do?
Yes, I had a young boy who was about 4 years of age. He had multiple issues with his with medical conditions, and he had visited many doctors prior to that, and he's had several operations prior, including his heart surgery and also his intestinal surgery. So when he came to me for a follow-up and subsequent care for his bowel problem, when he first appeared, he didn't want to enter my room, and that was one of the most difficult situations, because he's already been conditioned not to like doctors.
He literally did not want to step in.
He didn't want to
step in. So he threw a tantrum or something.
So I had to go out to him and say, look, I've got some toys in my room. Let's come in for a second, and then we can go from there.
Yeah.
So he decided to come into the room, and he was playing with the toys. Whilst he was playing the toys, I had a conversation with the parents, and he saw during that period of just talking to his parents, he was relaxing, he was looking at me, he was giving me eye contact, which I got reassurance that he was actually interested in knowing what's happening here.
Yeah.
So as he was being interested, I went over to him and played with him for a while, maybe a minute or so, and then he decided to kind of open up to me. And once that ice was broken, then I was able to just say, look, can I have a feel of your tummy? Well, just sat there, and then I had a look and examined him whilst he was sat in the same position in the play area. And once I've done that, I said, look, okay, that's fine, I don't need to do any more. And that's how we started the consult. And with every consult after that, I saw him many times after that. I had to tell him, look, this is what I'm going to do. I'm going to do to this extent. Would you allow me to do that? He will, of course, not agree initially, and then he said, okay, just a little. Then that's how we started.
Yeah.
So now he was, after about 10 consults, because he had a big issue, he immediately would lift up his shirt for me to examine him. So that was a big change from a person who was extremely anxious coming into the clinic, and basically to allow me to examine him without any issues was fantastic.
Fantastic. Yeah. Thank you, Doc.